thank you everyone for showing up for today's family practice physician event. And to all of those who are on virtual, hello, we're glad you're here. Just a little housekeeping. You want to make sure that you check in. There's the QR code there on the screen. You can use that. There's also the great questions sheet. So help you if you want to ask, but you're not sure how to ask the question, give you some good prompts there. We really want to make this as interactive as we can. And feel free to, should we call you Dr. Andrew?
Yeah, whatever.
And we want to take the opportunity to really give some good dialogue with Andrew here. And then at the end is the evaluation form, and we'll come back and show that QR code later for those of you who are online virtually. And then for y'all here, on the back of that little paper has the QR code for the evaluation. And where is my, oh, there's like lots of mouses moving. Hello, let's go to the next slide.
I'm trying, my computer's slowing down here, sorry.
So to reduce background noise for those of you who are on virtually, we want to make sure that you're muted. And again, just first names only. We don't want any last names. And feel free to put some questions in the chat box. I won't be able to see it, but we have both. We have Sam, who is going to be our co-host, and she'll be able to assist with those questions. And we want to give lots of attention, make sure your phones are put away, turned off, don't play any games, and watch social media. We want to be present because we really do thank you, Andrew, for being here. Andrew has been a career presenter for the past couple of years, but he did it virtually. So this is our first time getting to have him live and in person. And then this is being recorded. So for those of you who want to go back and watch it again, you'll be able to do so, or to share it with others who you think might really find this presentation informative. And then with that, I hope everyone enjoys it. A little introduction we'll do. My name is Karen. I'm the director of the program, and my pronouns are she, her. And the question we'll ask everyone is, if you were to go into medicine, what field would you want to work in? And then for you guys, also your name, your pronouns, what high school you're at, if you're interested in going into medicine, and what field would you want to go into? So.
My name is Gemma. My pronouns are she, her. I don't really know what field I want to go into. Maybe like being a therapist or something, but I don't know.
My name is Tiani, and my pronouns are she, hers. And as well, I don't know what area I want to, and I'm also like into the therapy one.
My name is Srija Tour, and I'm from Sunset High School. And I do want to go into medicine. I'm very passionate about it. And if I do go in, I would probably be an internal medicine doctor or a family physician.
Nice. I forgot to say mine would have been to be a OB. I love babies and delivering babies and all that, caring for the mom. So
I'm Andrew Jansen, he, him, and I, I'm family practice doc. So let's talk about that in a minute.
All right. And so with that, take it away.
You got a little slideshow?
All yours.
Can you turn your screen that way so I don't have to look behind me?
Yeah.
Because I don't memorize my talks. I just have like some slides and then I can look at them at a distance.
If you want to chat, and then I need to give yours up.
There we go. Come somebody else in the room. Yeah, that's helpful. That's good. All right, so so I'm Andrew Jansen. I'm a family medicine doc in Hillsborough, and I'm glad you guys came, all of you, including you virtual peoples. Thanks for coming. I just put that picture on there because it's a picture from, I think it's from Ethiopia. It might be Rwanda, but I think it's Ethiopia, and it's kind of fun. It's just a hippo. So on to the next one. Let's see. What's next? There we go. Turn a little bit more my way so I can, and it's just awkward if I have to turn around, right? So I thought I would tell you a little bit. Here's what we go through. I thought we'd go through a little bit about how I got into medicine, because it wasn't quite your direct route. I wasn't really on track as the three of you. So I was a little distracted, let's put it that way. And then medicine, like what my experience has been, many options, because I think it's easy to show up and think like, there's doctors and there are nurses, but there's like a billion other people who work in medicine, and you can figure out kind of there's a pathway for a lot of people. And so some of those options, some of the benefits, I thought we'd talk about that, and then a little bit about the road ahead, like where do you go from here? Where do you go from here? So, and then questions, of course, to be part of this picture, by the way, is a little picture of a transport vehicle in Malawi. So where we worked briefly, it's cram packed with people. The doors never close. So me, I went to high school. Congratulations. At the beginning of high school, I remember distinctly going into this big room, and they said, "Oh, you've got 4 more years of high school." My parents had never really explained to me how it all worked. And I was like, "Oh, 4 more years? I can't do 4 more years." So, but you can do 4 more years. I promise you'll get through high school, and it gets better, actually. It gets harder, but better as you go along. So in theory, after high school, and maybe you take a year off, maybe you don't, then you go into college. And that's kind of the more traditional route into medicine, so to speak. I went to college and took a slightly different route. College is a really good place, I think, to learn a little bit about yourself, about your strengths, your weaknesses. You'll find out, oh, I'm not so good at like in-depth philosophy, but I'm better at this. I'm not so good at like art or painting. Hopefully I learned that earlier, and I better do something else. So you figure out what you're good at and not good at along the way. That would be also an opportunity to take like a gap year between high school and college, which we could talk about as well, to discover kind of what your strengths and weaknesses are. Some people do that. The British do that a lot. And Americans don't do it very much. I think maybe more Americans should, but that's a longer discussion, and we could talk about that too. College is a really good place to make good friends. I still have long-term friends from there, and I think that's an important part about college. It's your opportunity to learn how to learn. My kids still think they know how to learn, and I keep telling them, no, you don't know how to learn. You'll learn how to learn. And so hopefully you'll learn how to learn through the process. For me, I went and I did civil engineering. So I wanted to be a civil engineer, and so I got a degree in civil engineering because that's what, after a while, I decided I wanted to do. And then because it was easy, I stayed around. I got a master's in structural engineering, which involves like designing buildings for earthquakes and stuff like that. And then I worked for TriMet for a while, designing light rail. And then during that process, I was thinking, gosh, what do I really want to do in the long term? And I like working with people. And one of my very smart coworkers, she said, "Well, you're going to be doing something when you're 35. You might as well be doing something you like." And I thought, oh, she's right. So it was a little bit of pain and suffering, but the idea of getting back from one career path to another takes a lot of work. But once I kind of did that, realizing, oh, at some point I'll be doing something anyways, short of being dead, I would be doing something at 35. I might as well be doing something I like, right? So that's how I went back and went into medicine, because it was kind of the only thing I really know much about. And then got into medicine and kind of got where I am today. So let's keep going. I think there's more parts of this. Yeah. So I worked for TriMet for a while doing light rail stuff. And then I went to medical school. That takes, in the United States, you typically go to college and then you go to 4 years of medical school. Now in other places like India, I think it's a 6-year medical school. You go straight out of high school, you go in for 6 years. I have a lot of friends who work here who did medical school in India. And so it's a 6-year path. And there are some US medical schools that are a 6-year path. You can come straight out of high school and go in and then be done in 6 years. But it's typically 4 years of college, 4 years of college, plus 4 years of medical school. And then after that, my kids think is ridiculous. After that, then you have to go to residency, which means like you're a doctor, but you need a little more training because instead of letting you loose to practice on people, you really need some supervision for a few years. And so that's what we do at Hillsborough. We train future physicians in what's called residency. They go there for 3 years. In my case, family medicine or internal medicine, actually. They do 3 years of training there, and then they can go out and practice on their own. So I do family medicine with obstetrics, meaning I do deliveries. This is a picture, not in the United States, of a little baby getting warmed up in Malawi. So that's a baby woman. So that's my journey. Let's keep going. Let's see. So your journey, and we'll talk about this if you want, completely up to you. So I wrote a letter recently to one of my kids in high school, and I said, well, you need to think about what do you value? Like what's important to you? You know, do you want, to hang out with the stars and celebrities, or do you want to like be a monastic doing research somewhere deep in the, basement of some building? Or do you like working with people? Do you not like working with people? Do you want to work with computers? What do you want to do? What do you value? Because that's really important. Like, what do you value? So that as you go forward, that can be a part of kind of who you are. Along those lines, what are you interested in? Like, I really like studying, or I really like doing math, or I really like science experiments, or I really like psychology and how people work or don't work, or I like economics, what motivates people, whether like history, World War II, or all that sort of thing, whatever you like. So you have to, knowing a little bit about that, then lining that up a little bit with what do I want to do? Right? If you're really good at spreadsheets and not so good at art, maybe you shouldn't be a ballet dancer, right? Like you need to line these two up at least a little bit. And so you guys know more than I do, but that's important to think about, like what these things are. So then the question becomes, how do I get there? You may know that, yes, I want to go to the healthcare field, but you may not know where in the healthcare field you want to land. That's okay. It's perfectly fine. You're kind of going the right direction. You don't want to be organizing shows with the latest, act that's coming through the Moda Center. You really would rather do healthcare. So you don't have to worry about marketing stuff. You just figure out something else. So how do I get there? You need to know how to get there. We can talk about that. That's part of today. If college is a part of that, and not every career in healthcare requires you to go to college. It generally requires some form of advanced training. But if college is a part of that, like how do we get there and what does that mean? And then finally, like how do you prepare for that now that you're in high school? What could you be doing now that might set you up for a better understanding of what a therapist does or a counselor does or stuff like that? So we can talk about some of that. Another picture from Malawi. We spent only a few weeks there, but there's lots of fun colored pictures. That's in the market in Malawi, so they have nice fun. These are called shitengis, so they're worn by women as a skirt, basically. My wife has a group. Next. All right, so I made a long list of options, and then I was looking at it again last night, and I made it longer. So I hate to bore you out, but there's a list of options, and I'll just explain them to you because, like, you walk into a clinic, or you walk into a hospital, or you walk into a therapist office, like, there's one person there that you think about, oh, I'm going to go see the doctor, but there's like a billion people who like participate in getting you there and the team process, some of which requires additional training. Some of it's more like an entry-level job, like scheduling, you don't necessarily need a lot of training to do that, but it's a good way to get into the system, and maybe you kind of get training along the way. So like paramedics, right? Paramedics are part of the healthcare system. You don't necessarily go to college, you get paramedic training, and there's a whole long thing for that. And that's kind of fun and different and exciting. Some people go into that and then they move on to nursing or vice versa. Pharmacists, there's people in the hospital who are responsible for making sure that the drugs you order are safely given. So they mix them up, or they check them, or they make sure you're not giving the wrong thing with the wrong thing, or mixing the wrong things, or this patient's allergic to a drug and you're going to kill them. All those things, right? You want somebody checking. That's what a pharmacist does. And they probably do more than that. I don't know. The nurses, there's like plenty of nurses, right? There aren't. There's a lot of nurses, but not enough. So nurses are obviously a big part of the healthcare system, particularly in the hospital or in the clinic. So this is Sunday's Oregonian. A friend just pointed this out this morning. Staffing shortages cripple employers. So this is an article on why Oregon produces the third fewest nurses per capita in the nation. And so they talk about nurses is a really well-paid job. It's a really highly in-demand job, and yet not enough people are getting trained to be nurses. And what are the frustrations, what are the joys of going into nursing? But nursing is a big part. And you generally have to go to college to become a nurse. So you do either, you used to be able to do like a 2 or 3 year nursing degree. You really probably should just do a 4-year nursing degree because the way everything is going towards more education, not less. So nursing is a big deal. There's nursing assistants, like nursing assistants. You can get a nursing assistant, a CNA thing in like 8 or 12 weeks, I think. And then you can get a job. And then sometimes that's an entry into different things. Who knows? Mental health. You guys mentioned therapists, counselors, stuff like that. There's lots of mental health options out there. There's going to be a need for more. So that could be a counselor, like a school counselor. It could be like a psychologist, somebody who, I don't really understand what psychologists do, but they help a little bit with counseling and they help people understand kind of how to move forward from where they're at. Probably the most helpful part of mental health in many respects. And there's psychiatrists who are doctors. Psychiatrist is a doctor, but they do mostly medication prescription. They don't do a lot of counseling, which people think they do a lot of counseling, not so much anymore. So that's good enough. There's a lab. Remember, there's a lab. People draw your blood. It has to go somewhere. You spit in a cup. You have to look at that. Somebody has to look at it under the microscope, whatever that is. So the lab takes stuff and they look at it and they do genetics testing or they do other fancy testing or lab testing or whatever it is. And then they send me the results. Lots of people in the lab. And so if you like kind of quiet work away from lots of people, you like doing things with microscopes and stuff, the lab is a good place to be. The blood bank, taking a bunch of blood and figuring out, oh, well, let's make sure we get the right blood to the right person. Imaging is really cool. So imaging is like, you used to go to the doctor and they'd like get an x-ray. So an x-ray is pretty easy. They shoot an x-ray and it looks cool and it looks like Halloween, bunch of skeletons and bones, right? But then imaging decided to go from x-rays to fancy things like CT scans and MRIs and ultrasound. And those, are really cool because you can see like almost the entire inside parts of everybody. You can see your kidneys and little kidney stones, and you can see the little things that shouldn't be there and all these things. And they're really, some of them are really amazing to look at. You're like, oh, that's really cool. So, and then ultrasound, you can do ultrasound of the heart, you see the heart beating, and it's incredible. So that is a really great option for certain people because it's highly in demand. It requires some training, but not forever training, and it's paid really well. So imaging technologists are really, they seem to be happy. So it seems like a good job. I don't know. I wanted to get one of them to come with me, but I couldn't figure out who to ask and how to get them to come. Surgeons are like physicians, right? Surgeons are physicians, but they're tend to specialize more in invasive procedures. Obviously, you got something, they got to cut it out or fix it or do something like that. That's what a surgeon would be, and that's kind of fun too. Physicians, obviously, kind of doctors. There's physician assistants who maybe I should move that bullet to the left because now they're basically at the same level as a nurse practitioner. They can act independently, essentially, in the state of Oregon, but it's a lot shorter training period. And nurse practitioners who are nurses, who then go on for additional 2 years, I think, 2 years of training, become nurse practitioners, and they can be independent. So physicians, PAs, and nurse practitioners can essentially all be independent practitioners in the state of Oregon, as I understand. Now, keep going. Last night, maybe, click on this somewhere, I'm not sure. Still active on the same one. There we go. Let's see. No. Is that it? Go back to where we were.
Nope.
Yeah, I'll keep going back. Go back to them. All right, there we go. Let's go next. All right, so we'll see where this goes. I may have put it later on. So my experience, right? So let me share with you my experience. So after catching myself out of engineering, then going to OHSU for medical school, I went to Alaska for training. So I did 3 years in Alaska, which was really fun. Alaska is a fun place if you want to go, anywhere, really fun. And then I went to John Day. Has anyone ever been to John Day? Have you ever heard of John Day? No. So John Day is a town of 1,800 people. That's like the size of your high school, right? So there's 1,800 people who live in John Day. and there's like 6,000 or 7,000 people in the surrounding area. And it's out in the middle of nowhere, and there's more cows than there are people. And that's where my wife and I were both family physicians for 10 years. And it's a really great place to be. It was really fun because you get to know everybody and everybody gets to know you, and you're working in a small town, and it was really cool. So as a rural family physician, I got to do, you basically see us if you come to the hospital, right? You go to the emergency room, you see us. You go to deliver a baby, you see us. If you come to the clinic, you see us. So there's a few of us, or 5 or 6 doctors there, but you get to do everything, which is really kind of the fun part of being a family medicine doc in a rural, smaller town. Those don't exist very much. There aren't a lot of small towns like that, but it is kind of fun. Alaska has a lot more small towns. So does Eastern Washington. We've also done some teaching in Rwanda. We lived in Ethiopia for 4 years. So we were training family docs in Ethiopia. That was fun. And we currently work in Hillsborough at the clinic, Cornelius Pass and TV Highway. There's a clinic there. So we work there, and then we work at the Hillsborough Hospital. So training residents there. This is another picture from Ethiopia. So not Hillsborough. I don't have a lot of Hillsborough pictures yet, sorry. Just to explain to everybody, including those of you on video, I haven't forgotten about you. Who do I see in clinic? So as a family doc, I see kids, adolescents, adults, older people. Standard problems include high blood pressure, heart problems, lung problems, cancer, depression, substance abuse. So all of those come through. Substance abuse like alcohol, meth use, marijuana, I'm beginning to think should be in this category too, because it's causing some troubles. So that goes in there. Younger people, so younger people are generally pretty healthy. Congratulations, that's good. Sports injuries, right? They sprain their ankle, something happens. Asthma, they'll have asthma, accidents, cuts. Anxiety and depression, pretty common, gotten worse with the pandemic. So see a fair number of people for that. That's basically kind of a lot of what younger people come through with. And then procedures, we do procedures, meaning doing something instead of just writing prescriptions. So we'll cut things out of people, or we'll do biopsies, or we'll inject things. That's kind of some of the more common procedures we do in clinic. There's a few others, but basically that's it. Then not everyone works in clinic and hospital, but we do. So in the hospital, we see a lot of people, mostly adults, who have heart failure or heart rhythm problems, or they have COVID, or they have post-COVID lung problems, or they have asthma or COPD or whatever. They have a lot of problems. Kidney problems, people have kidney stones, or like a guy last week, they wake up after being out of it for 3 days and their kidneys are dead, so they have to recover a little bit. It's yeah, shouldn't don't take too many drugs. It's not good for you. Substance abuse. That's very common. Alcohol detox. 72-year-olds still doing alcohol detox. Not good for you either. So yeah, people fall, they get older, they fall, they break their hips, so they have to come to the hospital, get fixed up. And then people who get surgery and then either have complications or just need a little extra help along it. Obstetrics, that means like basically delivering kids. That might be normal deliveries or C-sections, which is fine. And then I also work in other places doing a little bit of emergency care in rural places. So that's who I am. All right, what are we at now? Oh, why do I like medicine? That's good. So the picture is my wife, Andrea. So that's a picture with one of her patients in Ethiopia, who she really, really enjoyed, because he came in super sick and basically couldn't move and couldn't do anything, and got better to the point that he could leave the hospital. So she was really happy about that. And he was a young kid, I don't know, maybe 18 or 20, some rural area of Ethiopia. So got really, really sick. But fortunately, she has a story about that. She has a story about that. That's important. So, but it is nice. You get to work like therapists and counselors, and even a few doctors. They want to work with people who are sick, and they want to help them get better. So that's kind of a good thing. It could be an accident. They fell, they broke their hip, or they fell and hit their head, or somebody ran into the car, or whatever it is. That could be it. It could be after they come out of the hospital, they still need a lot of tuning up and helping. So they come to clinic. in tough times, people are wrestling with depression or anxiety or voices or whatever it is they're wrestling with. We try to provide a little guidance, and I'll admit we don't do a lot. We try to do our best to help people along the way and get them in touch with the right resources. And then try to love people as best we can in the midst of their suffering. And my wife, and I think I would agree with her entirely, is that we are called to be in people's lives with their suffering. And so that's the hard part of being in medicine, is that you live with other people's suffering, and you can either live with it and kind of let it roll off your back, or you can live and walk into the midst of the chaos and be there. And that's perhaps the better way to be a physician. So at least I would argue. So you get to, and you also get to help people when they're good times. There are some good times. They have a new baby, yay, they're very happy. They feel better after surgery because they get better, or bringing them some degree of hope that things will get better as well. Whether that's in the midst of depression or anxiety or whatever it is, that hopefully we can be there to help them and be kind of a helping hand. That's part of why I did this.
Ready for the next?
Maybe, I can't remember where I'm at, so keep going, let's see. Yeah, oh, yeah, and then we'll stop after this, maybe soon. Other benefits of working, so those are the kind of tangible, those are kind of fuzzy benefits, but really important benefits. Other benefits, if you like to learn, there's no end of learning. So if you like to learn, then being in the healthcare field is great, because things change and are different, whether it's the simple things like different medications or different treatments, or whether it's learning that what you learned 10 years ago was wrong and then you have to do something different, that's okay too. Or whether you're learning, oh, there's a whole new field of study that didn't even exist, like genetics or genomics or whatever it is. All of those things can keep you learning and keep you up to date, which is nice. You generally get to work with good people. Occasionally the doctors are a little self-centered and a little full of themselves, but other than that, you generally get to work with pretty good people, because they're motivated to be there. They like working with people. They're generally fairly smart. They tend to be hard workers. So it's kind of nice to work with good people, which is good. There's almost always a job. So for the most part in healthcare, there's almost always a need. It may not be exactly where you want it to be. Like it may not be in this hospital in this city or in this clinic in this city, but there's almost always a job. And if you were a nurse over the last 2 or 3 years, you got emails like every week saying, please come work here in New York or here in Maine or here somewhere for an exorbitant amount of money, because we need nurses desperately. So that's, there's always a job. And given the way things are going, and we can talk about this, I suppose, given the way things are going, like population's getting older, there's more medical care, there's going to be more need for people who are in the healthcare field. I don't know if that's good. That's a whole nother story. We have way too much dedicated to healthcare in the US already, but it's the way things are going. So there'll be probably more of a need, and it's certainly financially solid. There are jobs within healthcare that are not very financially solid. So a medical assistant who has some training after high school, but not a lot, is starting at the lower end of the pay scale. And so most of them are trying to move a little bit so you get more training. The more training you have in general, the more paid you are. So nurses are paid well, doctors are paid well, super specialist doctors are paid even better. So it's just kind of some continuum out there, but generally it's fine. Most people get paid well enough to be perfectly fine. So that's a benefit. Your parents will like it. So you can live on your own outside of their house someday, which might be good. Let's see what the next slide is. It may have been a continuation on other options. Oh, just a few cents. I found this somewhere, which is kind of interesting. So this is the estimated growth. This slide is a few years old, but it's roughly correct. So home health aides
Might even be higher now.
Yeah, maybe higher, exactly. The home health aides don't require a lot of training, but as I said, there are a lot of people getting older. As people get older, they need help. They need help, so they need home health aides. So it's a huge area of growth. You can see that, like a 40+% area of growth for home health aides. Personal care aides, same sort of thing. Physician assistants. So physician assistants, like I told you, are kind of like physicians, but they don't deal with quite as complex patients sometimes. huge amount of growth, as is nurse practitioners, huge amount of growth. Because there's a trend to try to do more outpatient, meaning more clinic work. Physicians and nurse practitioners can do a lot of clinic work, which is good, and they don't cost as much as a doctor. So if I was hiring people, do I hire the person who can do most of the work, who's half the price? Or do I hire the person who can do all the work and pay them twice as much? Sometimes you want to mix. So you need some more PAs and nurse practitioners, which is good. Physical therapy, I have good friends who are in physical therapy, occupational therapy. They do amazing things. Anybody's interested in like hands and how hands work and helping people use their hands and rehab their hands. They do incredible work. In fact, just a few blocks from here, over right next to Costco, is a physical therapy, occupational therapy group. Medical assistants are the people who help get you in the clinic. Physical therapists, aides. There's always aides, right? There's physical therapists and there's aides. There's medical assistants, there's always aides. That's kind of like the easy way in, and then you can work your way up. Massage therapists, I guess that's going up too. So, who knows? We can do that on the side or figure it out. I don't know. So that's some of that. Let's see. I'll put in another thing. Maybe keep going. Let's see here. Oh, it's very, very small, but I'll tell you what it says. These were the median salaries, I guess, in 2017. I can only assume they have gone up. But you can see it's interesting because they go from the top to the bottom. The top meaning like a radiation therapist, somebody who gives radiation, that's not a doctor, and $80,000 a year for an associate's degree, which is a lot of money, by the way. Sadly,
I think I need to go become a radiation.
sadly, probably about twice what some of your teachers make, sadly. And then dental hygienist, apparently the average income was quite a bit, 75,000. Registered nurses, 70,000. You can read this article if you want. It says something like that, $70,000 or $80,000 a year, apparently, plus overtime. Respiratory therapists, exercise physiologists. So this is just kind of a sense, and these are all people who have associate degrees, certificates, and only a few of whom have bachelor's degrees. So that's kind of, it gives you a sense of the broad range of options. Let's see, next slide. I think I put in another list. Oh, keep going. This is the same slide. I put it there intentionally to remind me. Just other things that were out there that I didn't mention: dentists, dental hygienists, eye doctors like optometrists or optometricians, podiatrists. You know what podiatrists are? They just do feet. Can you believe it? They spend all day long staring at people's feet. Do you know what people's feet look like? Some of them are very nice. Some of them not so nice. Let me tell you. So that's got its own challenges, but some people really like feet, so that's good. I had a medical assistant, she hated feet. She couldn't stand it if somebody had to take their shoes off. That would like freak her out, which is fine. She was a great medical assistant. Audiologists, they like to do check the ears, testing people's hearing, which is good. Chiropractors, they do some work on people's back, and I've already mentioned aides and assistants. I think we'll have one more and then we'll get to a discussion point. Just to let you know, so outside of, so we've talked about all these things, right? So we've talked about all these people who could work with people and help make them better and do all this stuff. Well, in order to make all this happen, there's a system. And the system is run by other people like hospital administrators or clinic managers or program directors, medical writers. Probably not a lot of them around there, but it was in the list. Health educators, people who teach people like, oh, what is diabetes? How do you manage your diabetes? What is healthy eating? How can I train you? Healthcare IT. So for those of you, anyone online, or you have friends who like computers, healthcare needs you because everybody goes to Intel and then they forget that people who are using all the computers are like the doctors and stuff. And when it all falls apart, it's really a mess. So there are super, super smart people who run the healthcare IT systems that OHSU, Providence, Legacy all run. They run huge, amazing, daunting computer systems that they have to keep going because the whole thing will fall apart if it doesn't run. So there's a huge opportunity in IT that I think goes unrecognized. And then there's also people who do sales. I don't know much about them, but they have to sell things in the healthcare system. So even for those of you into marketing, it's okay. We need you too. Let's see what's next. All right, so let's maybe pause here and see if people have thoughts. I have a few more slides, but not a lot. So what questions or thoughts has all this brought up for people? Any ideas?
Yeah, I have a question.
Okay,
So, you said that you were in civil engineering before, right?
yes.
So what caused you to change fields?
That's what I wanted to know.
So I think the lesson from that is it's okay to change. Which is a very American lesson. You should know that. Not everyone else. You do this. My friends from India tell me you get into medicine, you're into medicine. Like you're not going to change, right? My friends in Ethiopia, they're like, how in the world could you ever change? Because you don't change. Like once you get into a track, you don't change. So be aware that if you want to change, that's kind of fairly unique in the world of careers. But if you want to change, then you do have some level of freedom, particularly if you have a good college foundation, like a liberal arts degree or something like that, then you can build upon that and do different things. If you decide you want to go to window washing school and you want to be a window washer and every class is about window washing, 10 years from now, when you don't want to be a window washer, you don't have much to build on, right? But if you have a good, solid liberal arts degree that, it would allow you to do a variety of things, then you have some freedom, which is kind of cool. So that's just the preamble to that, right? So then I liked engineering. I really liked it. It was really fun, but I learned that as I grew into who I was, I liked working with people better than spreadsheets. I still like spreadsheets. I really do. I still like computers. I like spreadsheets. It's good. People think it's weird, but I do. But I like working with people more. And so I found that over time, as I looked forward, I said, what happens in this in 10 or 20 years? And I thought, I just don't really want to be doing what those people are doing in 10 or 20 years. I would like to be working with people. And so that's when I kind of started making my kind of, what am I going to do discussion. So personally, I think that's a healthy thing to have that discussion with yourself. I know it's kind of weird to talk about having a discussion with yourself. Don't worry, it's not mental health, it's okay. So you go from, you just like, what is it about what I'm doing that I like? What would I like to be doing and how am I going to get there? And so that was my discussion, was like, I really would like to be working with people. I know a few people in medicine. Maybe I could do medicine. How do I get there? Sort of thing. And then that's how I transitioned out. And do I miss engineering sometimes? Yeah, I do. But I really like being a doctor. So I'm happy doing what I'm doing. But I think it's a reasonable thing. You are all in the fore end of this. So you can say, aha, how do I build a pathway forward that has a solid foundation from which, because you really don't know what you want to do. Like maybe a few of you do. My wife wanted to be a doctor when she was 12. So she knew what she wanted to do. She wanted to be a doctor when she was 12. She hasn't changed. That's great. Fantastic. Amazing for her, not for me. So build a decent foundation. And then as you're building that, you can say, aha, I like this. I like that. I like that. And then you can move forward. Does that answer part of that?
Yes. It does.
Yeah. You had a question. Somebody else did.
My question was similar to hers.
Similar.
Or
Okay.
like basically the same.
No, that's a good question.
But how long did it take you to go from like college to figuring out what you wanted to do, like to get where you are now?
So I started in college. I did 4 years of college, 3.5 years of college, and I did 2 years of grad school. I went into structural engineering because they paid for it, so I did do that. And then I did 6 years of working as an engineer. So now we're 12 years out of high school, and then I started med school. So
What was
most
that?
people start med school like 4 years after. But some people, there were other people there. There were former teachers who were there. Like I have a colleague, she used to be a kindergarten teacher or an elementary school teacher, and now she's like one of the leaders at OHSU. So there are people who take non-traditional routes into medicine. You were going to say.
And what was that process of deciding where to go to medical school and what to specialize in?
Yeah, the process. Well, let's assume that you're smarter than I am. Okay, let's assume you go to college and somehow you figure it out and you decide you want to go into either becoming a physician assistant or a nurse practitioner or maybe even a doctor. If you want to be a nurse practitioner, then you become a nurse, and most of those who become nurses, once they become a nurse, then they decide either somewhere along the line or a few years later, they decide I want to be a nurse practitioner, because instead of just doing the things the doctor tells them to do, they want to diagnose and order things. That's what we call it, diagnose and order things. So then they want to do that. So then they have to go back for 2 years and do a little training and stuff like that. So that's a relatively short path after they've gotten their nurse degree. Physician's assistants, I think, can go straight out of high school into a physician assistant training program somehow. And then they get out 4 or 5 years later, and then they go straight into medicine. Maybe a year of kind of shadowing internship. I'm not sure how it exactly works, but it's a shorter road. If you decide you want to go into medicine, then you go to after college, you stand there and you say, do I really want to do this? And you look at the huge cost of doing this and you say, yeah, I want to do it. And then you jump and you do it. And then for 4 years, you go to medical school and it's painful and it's miserable and it's kind of fun all at the same time. And then towards the middle or the end of that, you figure out, aha, I want to become a plastic surgeon, or I want to become a general surgeon, or I hate people and I want to become a radiologist because I like dark rooms with pictures and I don't want to interact with too many people. Or you want to become a dermatologist because you like looking at skin, or you become an OB, or you become a family doc, or whatever you want to become. You kind of figure out somewhere in medical school what you want to do, and then you go to residency in that. Meaning you have to apply and you get interviewed and go to residency. And you spend 3 years there, or 6 years there, or 7 years there, depending upon what you want to do. Neurosurgeon, heart surgeon, 7, 8 years after medical school. So long road. And then you get out, and then you and you can practice on your own. Good question.
When you transferred from your civil engineering to medical school, like, did you have to go back to college to take any extra classes?
No. Yes. Yes and no. So if you're smart and you do college in such a way that you have a solid foundation, like you take enough science and enough math, I don't know what else you need, I can't remember. If you figure out kind of what solid things are, like, yeah, I'm going to do something in the science field, then you have to do enough math. Then you only have to do a few extras. Like I had to do biology and 1 or 2 other classes. So I only had to do a few extras. So I just went and did those on the side.
Okay, while you're
Yeah.
working as a.
Well, isn't it?
Oh.
Yeah, exactly. So you can do that. Lots of people do that. They go back and or you can go back. Some people go back for pre-med programs. They graduate and they didn't do everything they needed to do. So they go to a 1-year pre-med program and they take all the classes they want. I did biology at PCC, and then I did some other chemistry classes somewhere else. So, because I was living in California at the time. So, yeah, there are ways to do it. The easier way is to like figure it out on this end and kind of line up a path that works for you. So, what's been your experience with the healthcare system that's led you to be interested here? Not like, I was in counseling for 10 years type of thing, but like what experience led you to get interested in the healthcare system?
When I've been actually interested in medicine for a long time.
Okay.
And then when I went to 6th grade, I had my first biology lecture.
Hmm.
So that made me fall in love with the science behind medicine.
Oh, there you go.
And then I'm a freshman now.
Hmm.
And so these past 3 years, I've been looking at videos about doctors. And now I've fallen in love with treating patients as well. So that's why I was thinking about being a doctor.
There you go. That's cool. So biology drew you in.
Yeah.
How about you two?
I wasn't actually sure if I wanted to get into healthcare, but I knew I know I want to be able to help people in some way, but I'm just kind of not sure how or which direction I want to go.
That's cool.
Yeah.
No, yeah, you can help a lot of people this way.
So when I was little, I loved, my mom was pregnant and I just would love to hear the baby in there.
Oh yeah.
It gave me some passion into there's life in there.
Mm.
And I actually wanted to become a general surgeon.
Mm-hmm.
But my whole fear is what if at some point I want to change and all of those years of study would become
No, I think that's actually, you raise a really good point. I think it's helpful, particularly if you want to go into a long track career, to know what you're getting into. So it's harder when you're in medicine. Well, I don't know if this is true. I think it's harder for people who go into medicine to feel like they can get out. So it's better for you to be fairly certain. You're never going to be 100% certain. Maybe you are. I don't know. I'm not 100% certain. So it's good to be fairly certain that you want to go on this long journey and this long road. So finding a way to be an intern with somebody or shadow people or hang out and watch them is really helpful. Because then you get a sense of, oh, I want to be in this medicine field, but I don't know if I want to be like a heart surgeon or a lung surgeon. All right, well, that's, it's pretty narrow. You can choose one of those two. But if you don't know, like, I want to be a surgeon or I want to be an artist, you better like back up a little bit and figure out like how am I going to decide between those two? Because the surgeon and the artist are really fairly different in many respects. But if you want to be like the difference between a surgeon and a psychiatrist, all right, well, maybe I go to medical school and I spend the first year or two to figure it out. That's okay too. So those are really good questions. Yeah, because it is hard, particularly nowadays when people's debt is very high. So you go to high school is free, right? Congratulations, high school is free. Hooray, that's exciting. College might be free, might not. If you're lucky, maybe you get some scholarships, maybe it's relatively low cost, probably not. These days it's kind of expensive. And then you have to figure out like, do I really want to take out a bunch of more loans to do another 4 years of education? The average debt these days coming out of medical school is like $300,000, which is a big number, like not to be trivialized. So you have to you also have to be practical. You have to stand back and you say, I'm going to come out with this debt of $300,000 a year. And I want to work taking care of, poor people from the couch in my little, 2-bedroom apartment. It ain't going to happen because you're never going to pay off your debt. So you have to figure out like what's a reasonable expectations in the midst of all this, because as you go through education, you're going to incur some level of debt, which is fine, assuming that you have a job in the end that will pay it. If you end up, a few people end up either dropping out of med school or somehow not making it through med school, and then they don't have a job, but they also have a huge debt. And that is a bad position to be in. So you have to be a little cautious about kind of how you move forward in that regard. It's not all, something in roses. It's not all it's not all particular. It's not all necessarily pretty along the way. Occasionally you have to be strategic. But that's a really good point. That's for sure. How about those of you online? Are you still there? Are you awake? Did you fall asleep? Anybody online have anything for the chat or questions, or what inspired you to even bother coming other than getting a few times out of school? Give me an hour.
I have a question.
Go ahead, please.
So you said that you have to go to college first to become a doctor, like on your journey to become a doctor. So
Yeah.
what exactly do you do in college before you go to med school? Are there prerequisites to med school that you have to do in college?
So that's a really good question. So the answer is yes. Where those prerequisites are or who has that list, I don't know. Like OHSU, if you look up OHSU School of Medicine admissions, they will have a list of these are the classes we expect you have taken at college. So, and they're not 4 years of college. They're going to say, we want you to take a year of chemistry and a year of biology, and we want you to know how to write a paper, and you have to have done math. And there's probably some other things in there too. But it's not 4 years worth of classes. So the requirements will be, you have a bachelor's degree from an accredited university, plus you've done at a minimum these chemistry classes and these biology classes and these math classes. And there might be one or two others, right? So it's a good question. What do you do at college? So part of what you do is that, right? But you could probably do that, to be honest with you, in 2 years. So, but they require you to get a degree because the American healthcare system is such that you have a bachelor's degree before you go get a doctorate. And so that's just the route you take. And so my encouragement would be that you do something meaningful to you in the course of those 4 years. So I have a friend who's a doctor and he majored in music because he loves piano. He's a really good pianist. Yes, he did his biology and his chemistry and his math, but that is personally important to him. So he majored in piano. You can major in English, you can major in journalism, you can major in history. All of that gives you a depth of understanding the human experience that will help you as you go into medicine. Because sitting there with a woman who's had a newborn 6 weeks ago, who's thinking about, why do I feel like I want to stab this child? That is a human experience. It's not biology. It's not like science. It's not like cells. It's like emotional connection. Like, how do you connect and have a relationship with this person and help them understand what they're going through as postpartum depression? And we need to help you through this. That's human connection. And that's part of your 4 years in college. Like, you just do a little bit of growing up. You have some experience. Yes, you do the classes. Those are really important. Yes, you pursue your own passions, but there's also just an opportunity. And as part of that, when you apply to medical school, I guess you're getting a long-winded answer here. I apologize. When you apply to medical school, or you apply to grad school as a counselor, or you apply to be a psychologist, or whatever you apply to be, physical therapist, all these things, they don't care a lot about your classes. Everybody has to do classes, check. Everybody has to do well in classes, check. So everybody has done well in classes. They've all done their classes. Now, how are we going to tell from the 5,000 people who've applied for these 50 positions who we really want? Well, who's done a little volunteering, who's been involved with their community, who can speak Spanish and really understands the needs of the farm workers, who has something that has shown they really have an interest in human beings and have kind of dug deeply and tried to do that. So that's also part of the college experience, is you need to find a way not to just do the classes and check the check marks. You've got to find a way to explore your own interests in a meaningful way. So you're exploring your own interests, and at the same time you're building up a portfolio, resume, CV, whatever you want to call it. You're building up a body of evidence that says, I really do want to do this, and I've tried some things, I failed at some things, I've succeeded at some things, but I've gone out and given it a shot. And I'm not just interested in kind of checking boxes and getting in. Does that help answer the college question?
Yep.
Thanks for asking. No. Other questions out there from Video Land? Anybody out there with other deep, pressing, passionate questions? This is your last chance. You're not going to have you able to do this for the next year or so. So you probably should try.
I have another question.
Yes.
So when you were transitioning from engineering to medicine, did you have to go back and do the volunteering?
Yeah, I mean, I did some. Because it was a non-traditional route, I had a lot of other experience that I could bring to the table. But yeah, you have to show some level of interest. You have to say, I'm interested in human beings. I volunteered tutoring, or I volunteered with this, or I volunteered help with that. So I think that, yes, you have to have more than just, I want to go to medicine and I'm older and I'm experienced.
Did you
Yes.
do any research or anything?
I did not do any research. Some people do. Research is like a pretty common entry point to. I did some research in engineering, but it didn't have any cross connection. I think a lot of people are interested in research, and I think universities, some are more interested in research than others. And so when you apply to medical school, some are more clinically oriented. Like, yes, we like research, but our people are really clinically oriented. Some are yes, we like clinical, but really we do a lot of research. So I suspect, didn't apply, but if you apply to Harvard, you're probably looking at, like, you have to have a lot of research because that's what they do. Harvard, Stanford, these places have done a lot of research. Not places I applied. So that was very simple for me because I didn't have a deep interest in the research end of things. But you can, and there are, I don't know what opportunities are interested. You have to talk to your teachers about pursuing interests of that at the high school level. But I know, you can certainly do some of that, or you can begin to explore it on your own. But it certainly looks good. Like, if you're interested in research, like why, if you give people these incentives to help improve their mental health, do they not do it? Like, why do people sit in their house alone? And if I tell them, oh, come to my doctor's office, I can help you with your depression, why do they sit at home and not come? There's probably 1,000 answers to that, right? But that's an area of research. You could be like, wonder why these people waited 6 months until they were feeling like despondent before they came in. Well, maybe they couldn't afford it. Maybe they didn't have insurance. Maybe their self-esteem is low. Maybe self-confidence is low. Maybe. That's research, right? The other research is like, oh, you have a frog and he's in the little plate and you zap him on the back thing and see what he does. That's also research, right? Maybe a little more brutal or scary, but there's bench research, lab research. You can drop little things in and grow bacteria and see what happens, or there's psychology research. There's all kinds of types of research out there. Yeah, is my point.
What was your thought process on how you picked your medical school? Did you look at like Stanford, Harvard?
No. It was very simple. So
Or-
if you get in medical school at all, you're lucky, right? So you're lucky if you get in at all. So you take anything you can get. The bigger question is like, who do you apply to make sure you get in? So, but I happen to be an Oregon resident. And so it was an easy decision because I was an Oregon resident and it was cheaper. And I would just use a decent med school. So it was pretty simple. Like any of them will do, it's fine, but it was cheaper and it was close to home. So most people don't have unless you're not going to a state school and then you're paying a lot of money to go here or you're paying a lot of money to go there, then there's lots of other questions about that. The same is true of college, right? The same is true of college. Like, where are you going to go to college? Like, if you're going to medicine, you have to go to college generally. And so where are you going to go and how much is that going to cost and what's your experience going to be? And that could be a long discussion, right? But you have to figure out like, what's a college that can support me in terms of my own interests and my own endeavors and where I'm going. And not only to college, like where are there people who are interested in things like I'm interested in? If you go to a college that, let's say you were interested in engineering and you go to a college that's purely a liberal arts college, then your ability to pursue that interest is probably low because they don't have an engineering department. And so you probably can't do engineering, right? So having a college that will support you in doing what you want to do is kind of important. Yes. So the college question, the medical school question, whatever the grad school question is, Pacific University, for instance, has a great graduate program in physical therapy, as well as a few other really good programs. Physical therapy is really well known, so it's close, But there's also another physical therapy program, I think, in town that might be less expensive. So then you have to figure out in the end, which is going to sure be better. There's a lot of questions along there. Good question.
How many medical schools did you apply to?
8 or 9. Some people apply to more.
Yeah.
Some people apply to more. You have to figure out how many colleges to apply to first. Unless you go to the 6-year medical school, in which case you'd have to apply soon.
Oh, yeah.
That's another story. That is true.
With the shortage of physicians and the aging out, do you see that it will not be as difficult to get into medical school,
No, it
but
will get
they'll open up
worse.
more?
It will get worse. They're opening more spots, but it will get worse. There's more people are applying. And I think it's considered kind of a relative, it's prestigious and it's got a reputation and you're gonna get paid well. Yeah, I don't think it's going down. I don't think the interest is going down. No, it's interesting that. Other thoughts from Video Land? How about you people out there? Any more Zoom? What are we on, Zoom or video, whatever you thing is? I
What's
don't know.
what do you think was your favorite or most impactful experience?
Where? When?
In your
Getting
medical
married? Getting
career?
married? Like, in my medical
In your
career. There
medical
we go.
career?
That's helpful. That's an interesting question. What was the most impactful? During your 3rd and 4th year of medical school, and this doesn't have to happen in medical school. They send you out and you have an opportunity to spend time in different places, in different offices. So that might be rounding with the surgical team or rounding on OB or doing internal medicine in the hospital or whatever it is. It might be any of that. So I spent 6 weeks, as it turns out, in John Day doing rural medicine. And so that got me interested in rural medicine. So I'd say that combined with a few other factors was probably the most impactful because it was like, oh, this is a really cool job. This is really fun. This is really interesting. I like to do this. I'd like to do this. And so that kind of set me up for knowing what I wanted to do once I was in medicine. Before that, I think it's much more murky, but I would say as an experience, having time one-on-one with somebody who's in the fields you're interested in, whether that's, going to a physical therapist's office 2 hours a week for 6 months and just seeing what he or she does. That can be, any of that one-on-one experience, you're going to get a better sense of what they're doing and who they are, rather than kind of reading about it or watching videos about it or watching TikToks about it. None of that's probably going to give you like the heartfelt experience of like, why does this person really do what they do? And how could I see myself doing this? Yeah.
What is the difference between a family physician, a primary care, internal medicine? Are they, is a primary care and a family physician somewhat interchangeable?
Yeah.
And how different in pediatrics versus a family physician?
Right. So in your math classes years ago, you may have remembered that there are things called sets and subsets. Do you remember, like, you do a big circle, and then inside that circle, there's a smaller circle, and that smaller circle is a subset of the bigger circle. Anyone remember this sort of thing? All right, vaguely. Yeah, okay, that's good. So there are human beings, and then there are, then there are tall human beings and short human beings. They're all subsets of human beings. So primary care is preventative, generally outpatient, meaning in a clinic, care for people. That might be your pediatrician, right? You're 5 years old and you got to go see a doctor. You might see a family doc or a pediatrician, but there's somebody who takes care of kids. So pediatricians take care of kids. Family doctors also take care of kids. So they have a little overlap, intersection between those two circles, right? And they do that, but they also take care of adults. They take care of adults in here, and the internists, who are, what's another word for an internist? Internists, internal medicine doctors. They take care of adults. They don't take care of kids. They take care of adults. So they're over here. So they take care of adults, but they intersect a little bit with family doctors. Family doctors do a lot of adults as well, a lot of adults, because adults tend to be sick, right? Adults make bad choices and they don't take care of their blood pressure and they gain weight and they sit around and they eat bonbons, and anyways, they get sick. So that a lot of interns take care of those, a lot of family docs take care of those people. So they're all primary care. OB is kind of considered primary care. It's between primary care and specialty care, but they often will take care of women who are pregnant, for deliveries or other general gynecologic issues. And they overlap with family medicine too, because family medicine, some family docs do deliveries. So there's family medicine tends to, what they say about family medicine is basically cradle to grave, meaning you're born, we can take care of you as a kid, we can take care of you as you get older. Then as you get older and older, we can keep taking care of you and then take care of your kids, which is kind of fun because then you take care of the mom, the kids, yay, right? And then like maybe their grandparents, so you can take care of the whole family. That's why it's called family medicine. So that's what we'd like to do in the perfect world. So that's, yeah, it's all primary care. Family medicine is a part of that, pediatrics, internal medicine. And everybody has their own little niche. You might be a pediatrician who specializes in eating disorders. You might be a pediatrician who specializes in adolescent mood disorders. You might, there's a variety of things. You might just have an area of interest. Family doc is interested in geriatrics, meaning elderly care. So, or sports medicine. You really are cool into sports medicine and you want to, help people perform at the best as an athlete. And you get into sports medicine. There's a variety of other little things you can do along the way.
Why did you pick family medicine?
I picked family medicine. It's a good question because I am not a specialist. I am a jack of all trades, master of none. Meaning I like to fix my car. I like to fix my house. I like to mow my lawn. I like to cook dinner. I may not do any of it particularly great, but I like to do all those little things. And family medicine gives me a chance to do a variety of little things. It means I don't need to know every cellular pathway for like the latest diabetes drug and what's coming on in 10 years and how you deal with, some subset of super specialized diabetic genetic problems. Somebody needs to deal with that. And that's somebody up on the hill at OHSU, and I can send somebody there when they have that problem. but I want to take care of 90% of the problems that walk through the door and take care of them. And then the other 5 or 6% or whatever is left, I'm hoping it's not 10%, whatever it is that I need to send off to somebody, then I can send them off to somebody, a specialist. So if you come to me with pain, I can deal with 90% of it, but occasionally there's somebody who's got, like impingement on their spinal cord, and somebody's causing them super amounts of pain. They need a neurosurgeon. I'm not a neurosurgeon. I don't want to be a neurosurgeon. So I send them to my friend, the neurosurgeon, who will then fix them. And then they come back to me. And that's what family docs do. They kind of make sure they can take care of most of it, and they coordinate and know how to get people into the rest of the healthcare system. So if they need a counselor or a therapist, I say, oh, why don't you go see this therapist because they can help you through this. That would be great. And so hopefully the therapist knows how to get patients from physicians, because that's the way they get the patients, and then they take care of them over time. It's a really good question. And there's other questions about that are in depth that you get to ask along the way, for sure. Yes.
And also, so does anyone else have a question?
No, you.
In medical school, I've heard that's like very hard and stressful. So how was your experience in medical school?
I think it depends on your personality, and how inherently smart you are, and how much work you're willing to do. If you're willing to work hard, I think it's quite doable. If you're not interested in working hard, medicine is not a good road, because even if you get through medical school, it just gets worse from there. So, so I think that's the characteristic. I mean, in the end, it is what it is, and you have to do it. There are times when it's stressful, and there are times when you're going to fail and things are going to be miserable, but you have to figure out how are you going to deal with that. If you're like a super perfectionist, then it can be really hard, or you can do super well. And then, yeah, it's a hard question to answer. I think everyone's experience of medical school is very different. Some people end up taking 5 years to go to the medical school, either because of personal issues in their life, they have to take some time off, or because, they just need to decompress a little bit along the road because it's not so fun. In general, I think if you like learning and you like people, it can be an amazing experience. And then whether you do that in 4 years or 6 years or what the hell you do that out, yeah, it's interesting. Is there anybody else out there in the video land interested in medical school? I'm just curious.
Yeah.
Put your hand up. Oh, there's a few yeses, really. Anyone want to be like a neurosurgeon? Anyone know? Anyone know what they want to be? It's okay. I won't hold you to it, I promise. That's for sure.
Do you want to share what you're interested in about why you're interested in medical school?
You can if you want, it's perfectly fine. You can ask questions too. So, but how about the counseling therapy end of things, like questions, thoughts? How would you even learn about that? You have to find a counselor or somebody to talk to and ask them what it's like being a counselor all day.
Yeah.
I think it would be amazing, but I think it could be really draining.
There's such a high
Really
demand right now.
tiring. So you'd have to find a way to make that, sustainable. And I think there are people who do it and make it. We have a behavioral health consultant at our clinic. And so she's relatively new to our clinic, but very experienced. And so she knows a lot about counseling, and she does short-term, like, how can I help you get into resources that will help with your addiction problems or with your anxiety or your depression. So she does that, and she teaches some tools to help people learn tools that are helpful to them. But she does that, which is different than long-term counseling. Some people do counseling for 2 to 4 sessions. Some people do counseling for longer term sessions. Some people, it's more intensive. It's like inpatient counseling. So if you go to the eating disorders program at Providence, they have some eating disorder oriented counselors who are there and will help people through the inpatient program. as they wrestle with kind of body image issues and how are we going to get you to a safer place in your life so you don't disappear on us. So, and that's really, really important. And those people are critical to the kind of healing and recovery of these patients. But it's a very different type of counseling than, like even a school counselor, for instance.
Now, do you have your own private practice, or are you part of
Oh, so that's,
a
yeah.
larger consortium?
Yeah,
like
so that's an
Providence
interesting question.
system? So,
Yeah, yeah.
but as a
So if you watch movies, does anyone watch movies? Yes.
Yes.
If you go back maybe 50 years and you watch movies, you see the doctor, he leaves his little office, he grabs his little black bag. This is like the reruns that you're probably not watching, right? But anyways, they grab the black bag and they go and they see somebody at home and then they take care of them and somebody gives them a chicken, because they can't pay them for it. And then they go home and it's all fine and good. And that's great and it's very romantic and it probably exists somewhere, but not very much more. So small practice medicine, while it exists, and there might be a small resurgence, is not the future of American medicine. The future is large organizations. So Providence, I happen to work for OHSU, Legacy, those are the 3 big systems in town, Kaiser, 4 big systems in town. And so most everybody is working as an employed physician for those. There are other groups, the Oregon or the Portland Clinic, the Oregon something or other, can't remember the name of them. So, and then there are people who have private practice and they're smaller private practices, and I think they're doing okay. They're just a dying breed, meaning there aren't very many because of the regulations and all you need to know and all the overhead that's required. It's really, really hard to open your own show. Although it happens and people are still doing it, and in many respects it sounds great, but it's not generally the future of American medicine currently. That being said, I'm no expert in this, but there is a sense within the healthcare system that some of it is unsustainable, meaning like there's just so much demand and stress within the system, both financially and from a personnel standpoint, that something's going to have to change fundamentally over time. What that is or how that will change, I have no idea. So what I described to you today is probably not the healthcare system we'll have in 10 years. And that's true of the British healthcare system. The National Health Service right now is about to implode for a variety of stressful reasons, and that's bad for the United Kingdom. It probably won't implode. They'll probably find an answer, but right now it's like on super stress mode. And so the US system has also got a lot of stress going on. So things will change. And so there'll be people in leadership who need to be there to help through this transition, whether it's policy people or leadership people or financial people or economics people, or on the street doctors and nurses and everybody else. But there are a lot of changes probably coming at some point. So, but small town, like 1-person practice medicine, not out there very much. Maybe the plastic surgeons, they have their own offices, cosmetic surgery, they have fancy little offices with smelly things as you walk in, but most of us, not so much.
I'd like to read a
Go ahead.
comment that's in the chat.
Please.
Sanvi said, in response to your question about why you're interested in medicine, she said, my pediatrician inspired my interest in the medical field. I really like what they do and how much fun it is to be in the doctor's office.
Oh, Sanvi, I think that's beautiful. It's fantastic. And I interview a lot of people for medicine, for residency, for kind of moving into this. And a lot of people have a similar experience. At some point, they connect with a healthcare provider, either during their own illness or during their parents' illness or their brother's illness, or during, just growing up because they had a really cool pediatrician who they knew for 10 or 12 years. And they connected with them and they liked it and they thought, wow, I could do this. And all of those are really good reasons to explore the field of medicine because you have an interest, you've had some exposure, whether or not you end up becoming a pediatrician or a family doc or a surgeon, who knows, right? You don't know where those are going to lead, but you've had some sense of wow, what they do is kind of cool and interesting, and maybe I could be that too. And I think that's certainly true. I think the biggest barrier to going into all this is saying, well, that couldn't be me, or I couldn't do that. That's really not generally true. If you have an interest and a willingness to learn and a willingness to work hard, you could do this. It's just a matter of kind of going through the steps. And I would argue, I don't know that my medical school colleagues would agree with me, that in a sense, it's very easy. Because once you're in a medical school, which is really, really hard, the road is very, very clear. They tell you what you do. They tell you how to go to residency. After you're done with residency, they tell you how to get a job. Somebody comes and walks in the door and says, oh, I'll pay you $200,000 a year for working for me. And you say, really? Oh, that sounds great. And then you get a job. Anybody else, they go to college and they get their economics degree. And at the end of college, they're like, what do I do now? Like, do I go work at the library? Do I go work for the school district? Like the career path is not very clear. Whereas in medicine, once you're in the chute, you're done. Seriously, yes, you have to work hard. And yes, you have to get grades. And yes, you have to do all the stuff along the chute, but the chute is there. Whereas everything else, like you major in English, right? It's great. It's a fantastic skill, but like the world is wide open after that. You could be teaching English in Japan. You could be like, teaching English in a jail. You could be writing for a newspaper. You could be writing technical papers. Like it's a huge thing. And there's no clear path. In medicine, once you're in, there's a pretty clear path. So yes, it's difficult, but in a sense, it's kind of clear. Which is kind of something I think a lot of people don't understand. So, anyways, I hope that helps. Yes, please.
Is there anything you would recommend us doing in high school just to like, figure out if that's something that we want to do? Like,
Yes.
programs.
Right. So I wish I had a better answer to this. So I'll give you two answers. From an education standpoint, you should do a solid education, right? You should do, I would say, and this is maybe a little biased, you should do 4 years of math. You should certainly do 4 years of science. You should do stuff that's going to challenge your communication. And by that, I mean, I think they call it ELA these days, English language arts. Yeah. Anyways, English. You should be able to read and write. And you may think you can read and write, and you probably can read and write because you're all looking very smart. But do everything you can to push yourself to learn to read and write, because it's really important to be able to read and write and communicate. And so do that. Language learning is really useful. So like if you can speak a second language, that's great, because there are a lot of people, and there are going to be a lot more people who speak a second language. So it's really fun, even if you don't speak the language great, to be able to connect with people and have some level of, whether it's Spanish or Vietnamese or Hindi or whatever it is, depending upon your patient population. So there's that. What am I missing? History. I'm a big believer in history. Exactly how it plays into this, I don't know. But I think some fundamental understanding of kind of human beings and where we've come from and kind of our history is important. So, and then beyond that, which is not what you were asking at all, is like, what else could you do? So there's probably electives at school, right? But outside of school, you could say, I'm interested in this. I wonder how I would learn more about that. And I suspect if you asked your parents or asked your parents' friends or asked your school counselor and said, I'm kind of interested in physical therapy, or I'm kind of interested in counseling, or I'm kind of interested in like ultrasound, like how would I pursue that? They would help you find some way to get some shadowing experience. And that's where you'll get a sense, because you walk in and you shadow a surgeon and you're like, wow, this is the coolest thing ever. Like we cut in there and then we opened it up and we pulled this little thing out, we threw it away and we sewed them back up. That is really cool, right? Or you walk in there and say, this is terrible. I hate this. Great. You hate it. Move to the next thing, right? Move along, keep going, but try the experience. That was really hard to do 2 years ago in COVID.
And
Nobody, it's probably
It
still
is
really
difficult to
Exactly.
get a job shadowing right now, just to.
it's really hard. So I would do everything I could to move mountains to get you in. But I work for a system that may not allow that quite as well as we would like. So my job is to push the system to allow you to come in to do some job shadowing. And whether it's OHSU, Providence Legacy, you know, some guy who's running his doctor office out of a clinic, whatever it is, if you find somebody who's open and interested, they're probably not a jerk. They're probably okay, right? Because the guy who's a jerk isn't going to let you come in anyways, and you don't want to go spend time with them anyways. So if somebody says, wow, that'd be great, there's an interested high school student, like they might do it. And what's the harm, right? They say, no, we can't do that. But you know, my buddy Matt down the street might have an opening. You try that, who knows?
And that's what, like, the purpose of what our program here is working with the schools and providing these different opportunities to come in and hear, like, today's family practice, and then we have a pediatric doctor who's coming, and more of these opportunities.
Oh, you do?
visits.
Well, that's
Yeah.
fun.
Yeah.
Yeah, I mean, just look at these people on the wall, right? I mean, so not all of them are healthcare, but there's Metro West, ambulance, which is kind of cool. Portland Community College has stuff, which is good. A lot of these are high tech because we live in Hillsborough. Congratulations, in banking, which probably has a little less relevance to what we're doing. But the further over you move over, I mean, like there's OHSU, there's Kaiser, you know, all of these people have a presence in Hillsborough, and if they aren't making efforts to partner with the schools, they should be. So you could be part of that change to help them become engaged. Who knows?
And all of your schools have the college career counselors, but if you're interested in that pathway, or how do you get into it, check with them, and they're great in giving you that guidance and direction too.
Now let's keep going because I think I have some stuff on this. So yeah, I have one or two more slides left. So this is a kid in Ethiopia who I didn't meet, but it's a cool picture anyways. So let's see here. So road ahead. So keeping your eyes open, like being aware of what's around, what excites you, what do you like? Do you like working with people? Do you not? Do you like caring for people, whether that's your parents or grandparents? I've had a number of people who come through and they're like, I really like working with the elderly because I cared for my grandparents. Great, fabulous. There you go. That's what sparks you. Keep your mind open, like you're building your own future. So as you're taking classes, not all of them are exciting, not all of them are thrilling, not all of your teachers are amazing, some are good, some are great, some are amazing, maybe some not. It's okay. You can kind of move your way through. It's perfectly fine. They all contribute to you kind of developing and becoming amazing. Learning how to learn, that's important. And I know that sounds kind of awkward, but it's true. And then the more education in general, the better. Now, it doesn't mean the more high school, the better. Don't delay your high school. Finish up in 4 years. That's good. It doesn't mean like every class is worth taking, but some education. I mean, that might be a summer camp. It might be a summer program. It might be, you know, leading a summer program. It might be being a camp counselor at a summer program. Any of that, that's education. It's educational for you to be a camp counselor because you learn how to be a camp counselor. Yes, they're going to pay you, or at least you're a volunteer or whatever, but like there are opportunities out there. And then keeping your heart open is really important because we've talked about like, what do you like and all these mind things, like, what are you passionate about? What do you care about? Do you care about that, person who crossed over the border 10 weeks ago and is now stuck in some Arizona, like camp somewhere, and he's got 2 years waiting for the refugee program to go through? Like, what do you do about that? Like, how do you feel about that? Is that somebody you want to work with? Like, that might move you. You never know, right? Like, there's all kinds of things you can do. Let's see what's next. Maybe English, at least one. Yes. Yeah. Let's do that. Here we go.
Nope.
The road ahead. Oh, so details. We've done this. 4 years of high school, 4 years of college. You can do a lot with this. Working hard. I mentioned that once or twice. Graduate studies for those of you who need it. Doctors, counselors, physical therapists. All right. What's next?
So with that, what
Oh,
ongoing education do you have to have
Oh.
as a doctor, continuing education? And
yeah. So that's a good question. So, so you do 4 years of college, you do 4 years of medical school, then you do 3 years of residency, 3, 7, 9, depending upon which specialty you go into. And all of that's education in its formal sense. And then when you're finished, imagine, right? You imagine your doctor finishes, right? And then they go and they set up shop somewhere and they never learn something else again, right? So that's fine for about a year or two, but medicine is changing a lot. So apparently, and I won't quote this exactly, but apparently like every 3 years or 6 years or 8 years, like 50% of medicine changes. So like if you're not continually getting some sense of education or re-educated, then you're not practicing up to the standard of care. Meaning, you're still, what's an analogy I can use? You're still using, leeches to like drain people's blood because somehow that makes you better, right? That was the standard of care 400 years ago, right? Oh, you're sick, I better put a leech on you, or I better give you like the special tea or something like that. Teas are great and they might play a role, but you're trying to treat cancer with tea, not a good idea. You should really be up on the times. And so, yes, there's continuing medical education. And so in our case, it's almost all self-directed. Like there's opportunities and you have to have a certain number of hours every 2 or 3 years. So my case is like 100 hours every 2 years or something. So on the side, you read an article or you go to a class or you do whatever you want. It's much more self-directed, but there's lots of ongoing education.
What have you been doing for your ongoing?
That's an interesting question. So I'm in a leadership class this afternoon that is part of that. That'll give me 20 units by the end of the June, which is nice. And then I go to little classes here and there. Sometimes I go to conferences, but I'm kind of I'm tired of conferences break. So I'm not doing as many of those the last year or two. And you can do stuff online. You can do like little online modules that OHSU provides and learn those. You can read about things. There are podcasts you can listen to about things. There's even, not for us, but I was looking for you guys. There's like YouTube things on how to choose a career in medicine and stuff like that. I don't know if they're any good, but there are lots of opportunities for learning. That's a good question. But if you like learning, it's not a big deal.
I have a question from the chat.
Yeah.
Sanvi asked, which program would you recommend doing in high school, the IB diploma or health careers?
So Sanvi, you're gonna point out my own probably prejudices or preconceptions. I know a little bit about the health careers track. Only from what I've looked at in kind of the high school programs. And I think you would learn a lot in that track. Whether it's as rigorous as the IB program, I don't know. Because my prejudice is an IB program sounds amazing and it sounds incredibly challenging. And I think the more challenging a program is, the more likely it is to set you up for like being a physician in medicine. If you wanted to, if you wanted to explore being like an ultrasound person, or I think you could be a doctor from any of those routes, but I suspect depending upon where you want to end up, the more solid a foundation and the harder the classes are, that's what you should take. So if the harder classes are in the IB program and those are the challenging classes, then that's what I would take. If the harder classes are in the health track, then that's what I would take.
I think follow-up question for that.
Yeah.
And so, I think the health careers pathway is like a little bit easier. So based on what you know about colleges, what would they like?
So that goes back to, so that's my impression, right? So my impression is the healthcare track is a little easier because they're preparing people for this broad range of careers in the healthcare field, some of which require graduate degrees and some of which require like a 12-week certificate. If you're not interested in the 12-week certificate and you're moving more towards like the graduate degree, I don't know that all the extra stuff, while it might give you some insight, you're on a long road anyways, and whether or not you need a few extra classes on this or that in high school probably doesn't really matter. But of course, I went into engineering and I didn't know anything about healthcare for years, and I still managed to get into healthcare. So like the whole thing of doing it in high school, I think it's cool. Like if you knew, gosh, I really want to do this, and those classes are really exciting to me, and that's what I want to do, then that's great. If you're like, all right, I'm going to build a really solid academic foundation here, and I want to go on, because I want to be a researcher, you know, you better be thinking about like some pretty solid college, you know, and not just like, I'm gonna go to school like, you know, part-time, and I'm gonna work at Denny's part-time, and then I'm gonna go surfing on the weekends, you know, type of thing. You know, if you're gonna like go the full road, then it's like one hard thing after another. And it's not a generally a good rule, but like if there's an easy road and a hard road, as long as you're not killing yourself, the hard road is probably the right road. But you should check with people along the way at the same time. That's my bias. And I like the idea of an IB program because I also am kind of European, and I like the idea of a bunch of French people putting together an IB program because it sounds kind of cool. So that's my other bias. There you have it. I would have liked my kids to go to the IB program, but we're not in the IB district. So there you have it.
Another question from the chat.
Yeah, go ahead.
How flexible are the working hours in this profession? Do we have to go at any time when we're called to the hospital?
Yeah. So this is a great question, actually. How flexible? Because it turns out flexibility is actually really, really important. Flexibility and ownership of your schedule is really important. So this depends on what you do for work. So if you are a nurse, you're generally working 3 12-hour shifts a week. So that sounds great, right? You're working 3 days a week, fantastic. They are tiring, long shifts, but it is 3 days a week for a full-time job, generally. Now that might be 3 nights a week when you're a nurse who's just out of nursing school, which is a bit miserable. So 3 nights in the hospital, that's pretty tiring. And then you come back and then you have to shift to days, or maybe you don't shift to days, but it's generally shift work in that respect. So the difference between shift work, we need you at Denny's from 8 to 5, or we need you at Denny's from 6 to 3, right? Every day, or 3 days a week, or 4 days a week. And then there's a lot of medicine is shift work. You're an ultrasound tech. Here are your hours. Here's when you have to show up. Here's what you have to do. So that's fine. Nursing, that. Now, if you get into leadership, there's a lot less of that. You just have to be there a lot. If you're a doctor, depending upon the type of doctor, an emergency room doctor, it's shift work. You show up and your shift starts at 1 a.m. and you run till 9 a.m. And then you might drift over an hour or two because you have to do charts and stuff like that, but it is shift work. You are paid quite well for shift work. On the other hand, if you're an oncologist taking care of people with cancer, you're going to go to clinic, you're going to see a lot of people in clinic, and then you're going to get a lot of calls afterwards because so-and-so, you know, their cancer's gotten worse and they're delirious, or they're dying, or, you know, their chemotherapy didn't work, or they're vomiting all night long and you have to answer the phone. Hopefully you have partners who will answer the phone, but medicine is not generally a very forgiving career in that respect. It is traditionally a fairly demanding career, and depending upon the track you take within medicine, like a radiologist is generally shift work. They're going to work, you know, 3 8-hour, 4 8-hour days a week, whatever it is. I do clinic. Clinic is 8 hours. Now, then there's another hour or two after that doing notes. And that's if you're lucky. Some people take their notes home. That's bad. Shouldn't do that, but they do. So then they're working at home in their pajamas, writing their notes. This is a bad idea. But it's hard not to do it. Some people, you just have to do it because you have to keep up. So it is a fairly demanding career in that respect, but it's at the same time, it gives you flexibility. So I work 3/4 time, which is why I'm sitting here, because I am not working, in case you didn't notice. I am here because I work 3/4 time. So I work 3 clinic days a week, which is great, because it gives me a chance to come and talk to you. Otherwise, I'd be in clinic working. So it is also a very good career for part-time. If you want to work part-time and you can get paid well working part-time. So if you're a nurse, you can control your own hours. Say, oh, I want to work part-time. I want to work 2 days this week and 3 days that week. Great, that's fine. I had a friend who was just telling me the other day, his daughter-in-law was a nurse, and she said, I'll do this, but I don't work Sundays. And they said, okay, because they need nurses. So there's a flexibility out there. That's an important question.
So as you work in a clinic, do you ever go, if you have a patient of yours that got admitted into the hospital, do you go to the hospital?
So I used to, and I do for obstetrics patients, but now because we're hospitalists, if I'm not in clinic 1 week, I might be working in the hospital for a week. So I go there for 3 or 4 days and then just do hospital shifts. So a hospitalist is a shift work. They do 12 hours, 7 a.m. to 7 p.m. They work a lot and they get paid well. So, but they work 7 days on, 7 days off. This is a traditional hospital schedule. So it just depends, which works for some people. And some people are like, oh, that's really kind of, every other weekend I'm in the hospital and then know about that. But then you get a week off.
How does your day and your work life look like?
So a standard clinic day for me is I show up at 7:30. The first patient is right around 7:30. You see a series of patients. In theory, you have an hour off at lunch, but it never works because everything drifts in because I'm a little behind because I talk a lot, as you can tell. And so, or I listen a lot, hopefully. And then it drifts a little bit, and then I get 10 minutes, like jam something into my mouth for lunch. And then you do it again for the afternoon, and I'm hopefully out of there by 5:30. So it's basically seeing a lot of patients, trying to see what they need, maybe doing some procedures, which might be an injection or an excision or like a pap smear or something. And then, making sure I do my notes along the way. And at the same time, the people from yesterday or the day before, all their results are coming in. So they pop up on the computer and, oh, your cholesterol's high, or your blood pressure's high, or your thyroid is off, or whatever it is. I have to deal with those and send notes, or people are like, oh, I want a refill on this, or whatever it is, you have to kind of deal with those at the same time. So you probably have made, easily 200-300 decisions all day long. I mean, you're just making lots of decisions all the time, navigating things. You walk from a room where somebody is threatening to kill themselves, or they've been cutting all morning, or they were cutting last week. Like, oh, what do you do? And then walk to the next person, and the next person's, dealing with, some rash on their leg or whatever it is. So you have to kind of emotionally also kind of ride this little bit of a wave, because you have to be present. Like you have to be super present when somebody's super depressed. Like you can't be just like diddling on your phone and saying, oh, well, that sounds very sad. You have to be there for them. And at the same time, you got to finish at some point. You can't be there for hours. So you have to figure out how to navigate that, finish, and move on to the next person and leave that behind. Like you have to leave it behind. Like, oh my gosh, that person's life was horrible. I mean, I have heard stories that are terrible, terrible stories. And you need to be able to walk out of that and walk into the next room and smile and figure out how to move on. And that is really difficult sometimes. So there's a lot of emotional kind of balancing that goes on to it. Anyways, yes.
Does it ever get overwhelming to have to deal with so many different things?
Yes.
You have to you have to remember all these different areas, right?
Yes and no. So the advantage these days is you don't have to remember it all. So it's not infrequent. In fact, it's probably more common than not that I know what I'm dealing with, and I have an inkling of what the treatment is, but I can't remember the details. So at the same time as I'm seeing the patient, I will pull out my reference, like Up to Date, which is one of the references we use. I'll type it in. I'll say, oh, what is the treatment for this again? I'll pull it up and I'm like, oh yeah, the treatment is this. And I think I'll prescribe that. And that's what how do you feel about that? And what do you think about this? And we could do that. And we could do that. Okay, good. Right. Type it all out, be done with it and move on. Because you can't remember it all. There's way too much to remember. So you learn a foundation for how to approach the problem, how to think about the problem, how to hopefully figure out where you're going to go, and then draw on your resources every day, all the time.
So you're kind of doing a little mini research.
I do it in the room, I bet half the time.
Huh.
And that's not true of a lot of people, because as a family doc, as you said, I have to know a lot, right? So I have to know a lot. So I don't remember the latest treatment for sickle cell. Like I have one patient with sickle cell, and I don't treat sickle cell very often, but she couldn't get in to see anybody else. There is nobody else she could see for months because the system is broken. So I was like, okay, what's the treatment for sickle cell? Better look it up. Okay, well, this drug here, looks like she might qualify. Let's give it a shot. And off we go. And then 3 or 4 months later, she saw the specialist in sickle cell, and they wrote me a note and said, you did a great job. Thanks for starting. This is perfect. We're on our way. It's good. I love doing it. It's fine. Some people hate that. They absolutely hate not knowing precisely, fundamentally, exactly what they're doing. And that's great because that's why they're specialists. That's why they are rheumatologists. That's why they're sickle cell specialists, because they know everything about it, which is fantastic. And I need those people. But I'm okay being out on that kind of not so certain end of things.
What happens if you make a wrong decision?
That can be a problem. Sometimes it's not a problem, right? You try to couch it so that, well, yeah, I don't know what this is. Like, this could be that, or this could be that. All right, let's treat you as if it's this. The treatment is not going to hurt you, right? And if it doesn't get better, call me and we'll do that. That's an easy decision, right? The hard decision is, I think it's this, and the treatment for that is dangerous. So, like, what do we do now? Well, I need to be certain that it's this. So let's order some more tests, like to make sure that before we go down the road of treating you with something that could be dangerous, let's make sure that we know what we're doing. So then you have to like figure out, or you have to go see a specialist, like you have to go see somebody, right? But it just depends where you are and where you're at. But yeah, you have to learn to navigate that as well, the uncertainty, which I happen to like. Some people hate it. And so you have to know that about yourself. You have to know, do I like some degree of uncertainty? Am I okay with uncertainty? Or do I really need to know? And you'll learn this through college. You'll like learn who you are a little bit, and that'll help you figure out kind of where you want to be. Good question.
How much of your work involves traditional Western medicine, but then bringing in like naturopathic medicine or alternative medicine, looking at a more integrated, holistic approach?
Yeah, so
of
that's
modalities?
an interesting question. I suppose it depends what you mean by integrated to some extent. I mean, is massage therapy integrated? Is physical therapy integrated? I think there are certainly family physicians and other physicians who have a much broader experience with integrated medicine, anyways, holistic medicine than I do, whether that's naturopathic medicine or chiropractor. I would say that oftentimes it's the patient who is pursuing two roads simultaneously. I have some patients who see both me and a naturopath, and so they kind of carry the burden of navigating these two journeys. I'm aware of some overlap, but it's not as much as you would think. Yeah, it's just, I mean, are there acupuncturists at OHSU who you refer to or are part of the pain treatment team? Absolutely. Do I know anything about acupuncture? Really? No, not really. Can it be helpful? Absolutely. Do they go and see them? That's great. But do I really understand what they're doing? No, I don't really understand. I don't pretend to understand. But if they're helpful, that's fabulous. I think that road is still being navigated, unfortunately, because I think Western medicine is very strong at evidence-based medicine. There's a lot of emphasis on what is the evidence and doing what the evidence says. And there's been a lot of money for evidence, development of evidence in the Western model, a lot less money in the naturopathic alternative medicine realm. And so that makes it hard. That makes it harder for those of us in the kind of allopathic medicine realm to know how to bring it in, because we're looking for the evidence and nobody's given them the opportunity to generate the evidence. And so that's kind of tricky to navigate. Not to say it couldn't be helpful. On the other hand, you need to be aware of what you're doing. My wife had a patient who had complete liver failure because of herbal medications she was taking that she'd always said. So you have to, like, things that are safe are not always safe. So you have to understand it's tricky. It's a great question, but I don't think we've made a lot of progress in it. That would be my honest answer. Yes.
You said you and your wife went to Ethiopia.
Yes.
What was that like? And like, how did you guys find yourself over there?
So that's an interesting question. So we worked for 10 years in John Day as rural family physicians. We wanted to serve overseas. And so at some point, we went to Rwanda and we taught there for a little bit and figured out, oh, we and our family are not ready to go. So we stopped for a year or two, stopped, meaning we went back to John Day and kind of worked there for a little while. And then we were still open to the opportunity to go overseas and teach. And so we were in touch with other people who are working throughout Africa. There are people all over the world doing amazing things, amazing things. So my wife went to Zambia for 4 months during college. She stopped out at the end of college. She said, I'm done because I finished, or maybe it was close to being finished. She said, no, maybe it was her fall of her senior year. She said, I'm going to college. I'm going to Zambia because I know this mission doctor who's out in the middle of nowhere, and I'm going to work with him. And she had an amazing experience, and she could tell you amazing things about the orphans she cared for and the people she cared for and the people she lived among. And like just incredible things that would touch on the heart of things, like the heart of the matter, like why do you do this type of thing? And that carries her, and it continues to carry her. And that wanting to work with people, you think we need healthcare here? Let me tell you what it's like to walk into a city of 5 million people and like realize there's like a few doctors here, right? There is one doctor in South Sudan who takes care of a population of 1 million people.
Wow.
There are a little over 1 million people in Portland, and you can barely walk down the street without running into a doctor. Not quite true, but like there are plenty of doctors here, and we need more, right? The rest of the world is like in a whole different ballgame. So the chance to go and teach and provide some support for people who were pursuing education to treat people in Ethiopia, like Ethiopians. So we put our name out and we said, who's out there? We found a mission agency. The government of Ethiopia said, hey, do you have any family doctors who want to come and teach? And we had our hands up. And so essentially that's what happened.
Nice.
They wanted people to come teach. We wanted to go teach. There it was. That was it. Now we needed to raise funds and we needed to raise support and we needed to figure out how we're going to leave our jobs and go there and bring our kids and all these things, right? There's a lot of complicated things to it, but that's essential.
Did you get paid for teaching?
Very little. We went as missionaries, so we didn't get paid very much. But that's okay. We had plenty and we lived really, really well. Certainly much better than any Ethiopians. Not any, but most Ethiopians by far. So you don't need a lot to live on it. You can simplify your life.
Did you find that experience working international make you a better doctor here?
It's a complex answer because the problems they deal with and the way they deal with them is so very different. I think it made me a better human being. I'd like to think it made me a better doctor, but I'm going to think that anyways, right? I mean, like my bias is I'm going to think that whatever I did makes me a better doctor. So was it hard coming back into a system where there's electricity and computers and, you know, clean hospital rooms? That was really hard. Yes, hard to come back to, but we're both fairly flexible. It's hard both ways. It's hard to walk into a place where the windows are broken out and there's 10 people. You know, this room would have 30 beds in it and it'd be full of people and it would smell like you couldn't barely walk in if you weren't used to that sort of smell. With blood dropping, you know, it's just a mess, but it's amazing at the same time. It's like you're walking into like real humanity. So if you ever have a chance to work overseas or serve overseas, do it. Just do it. It's good. Yeah, absolutely. And not like a week like here, you know, like a week somewhere, like go. And yeah, anyway, go ahead.
What made you want to come back?
Oh, so yeah, it's another strong question, right? So what made me want to come back? And the answer is on a few different levels. One is we were training Ethiopian physicians to run their own program. We got to the point where there were enough trained Ethiopian faculty, they could run their own program. So they were able to take the program and run it. So they didn't really need us. My goal, as in everything, was to help them become the people who led their program, who took care of it. And they are doing that, and they're doing a good job of it. So could we have stayed and gone on and continued to do more, like another program? Yes, absolutely, for sure. there are frustrations with doing this, and we can get into the details of that at another time. At the same time, my kids were like about to go into high school, and I thought, well, if we're going to leave, you have to leave before they go into high school. Otherwise, like you rip them out in the middle of high school, and that makes things like difficult. So we decided for a variety of reasons, and our parents were getting older. And as your parents get older, you don't know this now, but as your parents get older, they might need a little help. They might need a little guidance before they disappear. And so that was our chance to come back before they disappear. So that was part of it. There was a lot of things, but it's a good question.
Well, we
Question from the
have-
chat. Hold on, one more
Yeah.
question.
Yeah, we've got
What would you
Go ahead.
consider was the most challenging skill to learn during residency or years of medical practice?
I don't, to say that I've learned the skill would be probably really the hardest skill is to learn to walk with people to walk with people alongside them in their life. I mean, honestly, that's a really hard thing to do because you have to listen well. You have to learn to listen. You have to value their opinions and their values, you know, whatever those are. You need to figure out how to work with them. You need to figure out how to motivate them. You need to figure out what's wrong with them. You need to figure out how to communicate with them. That really, I mean, you can learn things. There are things to be learned, and all of those are important. But when it all comes together in terms of actually sitting down and treating somebody and working with them to help them improve their life, I mean, some of it I've learned and some of it I haven't. It's hard to motivate people. They come in and their blood pressure's high or their cholesterol's high, and you know, they're still eating, eating out of McDonald's every day and not walking, not doing exercise. Like, how do you motivate these people? So learning, I think listening is a big part of that. So I would say one of the hardest skills is figuring out how to be present with people and yet helpful at the same time. I know it's a vague answer and maybe beyond kind of where you're at, but and if I get that figured out by the time I'm 60 or 70, that would be amazing. But it's just a lifelong learning.
So we have 4 minutes left. So for anybody virtually, this is your last chance to ask any questions.
Let's see if there's more slides. There might be one
Oh.
more, 2 more. I won't go through them, but because it's a summary and we've talked a lot. But my email's on the bottom. So you're
And
going to email me.
we'll share out the presentation, so
That's good.
you guys can have this. and
So
have
it's
it.
relatively simple. But yeah, you can always email me, and I don't know if I can be helpful or not, but I can try. So who knows? Other questions from the 4-minute people or the video people? Oh, it's a picture in Ethiopia at a lake with some of the Ethiopian faculty we worked with. So just kind of fun pictures from us. So. Hillsboro's great too, but I don't have very many pictures of it. So.
How was your residency experience?
Oh, it was fun. We were in Alaska. Alaska's really fun. So it's challenging. It's hard. You're doing things you didn't think you knew how to do or could do. But if you have a lot of support and they're a place that cares about you learning and surviving and thriving, you'll do, residency is hard, but you have a lot of support. It's all geared to helping people survive and do well. Tons of support. Yeah. Compared to other jobs where you're just kind of stuck out there and whether you survive or not, like some places don't really provide much support. So medicine, I think, is generally pretty good for that. That's a great question.
So with all of that stress that comes with the job, what do you do for self-care?
What do I do? Yeah, I have 3 teenagers. What do I do? Yeah. I run in the mornings. I like to read. I leave work at work as best I can. Yeah, those. I try to build friendships with people outside of medicine or not based on medicine. I try to do, yeah, those are the things I generally do. So, yeah, I like to go hiking and camping in the summer. Fun outdoor things. Okay.
How was your residency matching program then?
That's a detailed question that is an hour of discussion already. We could talk about that sometime. You will have an opportunity, I promise. That's a long discussion.
Where in Alaska were you?
Anchorage.
Hmm.
So I think all the training programs are Anchorage.
So you went there for residency?
Mhm. Yeah, which is fun. You get to go somewhere, right? And then train. You might as well go somewhere kind of fun and different.
Yeah.
Yeah.
Well, was the residency fun or?
That was pretty
working
fun
away and-
because they're all fun people, right? They're all outdoorsy people who go there and they want to go hiking on the weekends
Yeah.
and go skiing and all those sorts of things, right? It's not like going to Las Vegas where everyone wants to go to the casino or something. You know, not to put down Las Vegas, sorry. But it's just
Question.
fun.
Question from the chat.
Yeah.
Is there anything you found to not be of use when you were working?
Not to be what?
Not useful when you're working? Not useful?
Anything I found not useful. I mean, there's lots of things that are not useful. I mean, probably in your training program. Yeah, I mean, there are times when you're going to spend a week or two doing something that, you know, learning about something that you just have no interest in, but you do your best to get through it. You know, I can't think of a lot of things like that, but there's a lot of bureaucratic stuff that you have to read these papers or sign these things or take this training. And yeah, you're not passionate about learning about, you know, the things that mark your chemicals in the corner of the room, you know, the hazmat things and stuff like that. There's plenty of little things. There are no big things along the road that I would say that have been not very useful. But I'm also, like I said, a jack of all trades, kind of master of none. I like to learn a little bit about everything. If I were like an ophthalmologist who focused on one corner of the eye, you know, learning about gynecologic cancer, probably not very helpful to them. But to me, it's helpful because I take care of people with gynecologic cancer. So everything is kind of helpful to a favorite eye.
Okay, another question. Do you recommend doing the 6-year med program for people who are interested in medicine?
I would recommend exploring it seriously. I know nothing about it. I know very few people who've gone through it because in the US, it is not very common. It is the road in India, Britain, Europe. Everybody does that road pretty much. The Brits go straight out of high school and boom, they go into medical school and they do it for 5 or 6 years and they're done. And then they do a lot of training. But they do a great job, a fabulous job. If you know you want to go into medicine, I would explore it for sure. Will your high school counselor be able to help you? Probably not, because I can't help you. So, you know, you can ask them about it, but you're going to have to look into it yourself. And finding somebody who's done that road in the US is going to be hard to find, but finding the schools that do it, they might have some insight into that. But absolutely, I mean, if it's a passion and an interest and you confirm that and you're certain, then that may be a great road to do. Absolutely. Unless you're the sort of person that really likes to learn and you want a broad kind of foundation of knowledge and you really like, I want to go study Shakespeare for 4 years before I become a doctor, then do it. Go study Shakespeare for 4 years and then become a doctor. It's fabulous. But if you're like, I know I want to be a radiation oncologist researcher, then like, this is the road I want to do, then figure out a road forward. It might be the 6-year road. Great question. Honestly, you guys have asked great questions. I did not expect to be here for 2 hours because I thought you would all be boring and bored to me. So I'm glad you've asked me like really hard questions and you made me think a lot and realize this is only my perspective. So there's probably, you have different doctors, they're going to come in with different perspective and different ideas on things. You get my completely unvarnished, completely biased perspective, but it's been mine. So there it is.
Well, thank you very much. We really appreciate it. And I hope that everyone enjoyed it. And we'll share out the PowerPoint presentation. So you'll have those slides to go back to and then the contact information. I think you also gave a link on a couple of those pages that
Possible.
you'll get more information about. So
Yeah.
All right. So with that, you guys want to make sure that you fill out complete your evaluation because that's the way that you'll get the credit for attending, and it goes towards your graduation requirement. So you've got the QR code, scan that and complete that. If you're not able to do it right now at the moment, that's fine, just as long as you get it done in the next day or two. And then we have a couple events coming up. We've got not medicine related, but we do have real estate, residential and commercial, and then staging. And that's on Thursday morning. And then we have a pediatric physician who is in the afternoon.
Mm.
And I don't know if we have, that's it. I know we do have PCC, the veterinary tech program is coming up in February. And then we also have, on a Friday is the, with Pacific University, the dental hygienist program out there. And we are putting together a Explore Careers Day with Pacific University in all different kinds of departments. So great opportunities to come in and learn about the different specialties
Healthcare.
and subspecialties. Yep, healthcare.
You should invite us. Because I have lots of residents who'd like to come
Okay,
and help out.
Yeah.
I'm sure.
yeah, perfect.
Let me
Will do. So with that, thank you all for attending, and tell your friends about these events. And if you have interests that you're like, hey, school to career people, I'd like to have an opportunity to hear about X, let me know. Contact us and we'll work on creating those events, because most likely, if you're thinking it, there's others who are interested also. So, yeah.
Well, thank you.
Thank you.
Thank you guys for coming. It's great. Good luck.
Thank you.